Please bear with us if we experience any technical glitches. And I've been told that if you would like to turn on the captions, they've been enabled and they're down at the bottom of your screen. This town hall was planned. Oh, excuse me. We would like to take this moment to mention that one of the elected officials asked to be on this panel died recently. Perry Township Trustee Dan Combs devoted his life to making things better in Bloomington. He will be missed. This town hall was planned so that we could begin working together as we respond to the current fiscal reality of significant budget cuts. Since our country began, there has always been a tension between those who interpret general welfare as a small federal government and those who think we need some universal safety nets. Regardless of where you fall on that spectrum, we all can agree that the current political climate has shifted far to the right and away from universal safety nets. And like it or not, our elected city and county officials must play the hand they have been dealt. When Indiana became a state in 1816, it adopted a state constitution that created county government offices and specified the powers and duties thereof. Later, as the population grew, the state legislature passed enabling legislation that governed a community's ability to form local governments, city or town, with specific powers and duties. As these governments are created by state government, their powers and duties can only be changed by state legislators. It is important to understand the authority of local government, who has what responsibilities for providing local services and how to pay for those services. The problem is that local officials are given responsibility for such services as water, sewage, fire protection, and shelter for the homeless, but taxation rules are controlled by the state. The state legislature both sets and changes these rules with little regard for local differences around the state. For example, the state decided to end the financing of public school district by means of local property taxes, but then it cut public school money by diverting it to private schools. A school district could still raise some local property taxes by referendum, but then the state decided that such referendum money had to be shared with private schools, even those outside the local district. One of our state legislators, will explain how the proverbial fiscal can was kicked from the federal government to the state government to the local government through a 2025 Indiana budget bill. Although there are 4 state representatives with voters in Monroe County, only one said he would be happy to help us understand how the local government was put in this position. Representatives Dave Hall, Bob Heaton, and Peggy Mayfield did not respond to our invitation. If you aren't sure who represents you in Indianapolis, you can find where on indianavoters.in.gov. I'll say that again, Indiana voters at in.gov. Assistant Democratic floor leader and House Representative Matt Pierce from District 61 was first elected to the General Assembly in 2002 and is now in the second year of a 2-year term. Representative Matt Pierce.
Good evening, everyone, and thank you for participating tonight. And I'm glad we can do it from the comfort of our warm homes rather than being out in the frigid weather and the snow. Well, I think the point that I wanted to make is that you have to understand that the supermajority that has been in charge of the legislature since 2011 is pretty strong believers in what I call the Laffer curve, right? Not what I call, but what economists call the Laffer curve. And this is the idea that the more you cut taxes, the more economic activity you will get, and therefore the more revenue you'll actually get in. Now, most economists, I believe, have discounted this theory as actually functioning, but this is kind of the attitude of the people who are making our tax and fiscal policy. And so not only has the local government been kind of treated in a way that, hey, if we just cut taxes, we'll have more taxes in SB 1, but we're also seeing that over the past decade. So, for example, the income tax was at 3.4%. It's now going to be down to 2.9%. The inheritance tax was repealed. The corporate income tax went from 6.5% to 4.9%. The financial institutions tax was also limited. And so over the past decade, there's been billions of dollars of revenue that's eroded from our treasury because of all these cuts. And the idea is that it will generate economic activity and bring more jobs in. But I think as Professor Hicks at Ball State has pointed out, when it comes to SB 1, which significantly cuts the revenues of the local units of government, you're really not gaining too much from this strategy because, first of all, you can question whether the Laffer curve actually works. But more importantly, people who have the growing economies, if you look around the country, are people who have enough revenue to create a strong quality of life. They have good schools. They have affordable childcare. They have the kinds of amenities that people are looking for in their community. And if you don't have the ability as a local unit of government or as a state to build the kind of quality of life that people want, you are not going to get people to come to the state. And you need to have people coming to the state, particularly in Indiana's case, because we are not developing through our school system, through the university system, because that's been devalued as well recently. We're not getting the kind of workers that are going to fuel these jobs of the future in our artificial intelligence kind of economy, which is coming on. And so instead of investing significantly in human capital, we are just essentially cutting taxes on businesses and the wealthiest people in Indiana. And that's another kind of side effect of this. The impact of these cuts is that the people on the upper end are getting the biggest benefits. So we have a flat tax in Indiana. So, you know, the tax cuts on the income tax, if you earn $50,000 a year, that gets you $250. If you make $250,000, that same tax cut got you $1,250. And so SB 1 is the same way, where ironically, if you have a very modest home with not much assessed value, you probably get little or no property tax relief. However, you're probably going to end up paying a bigger chunk of your income in income tax because what the legislature has decided is if the local units can't make it with reduced property taxes, then they'll just have to increase their income taxes. And that is kind of the irony of this system. So what I see when you step back and look at it in perpetuity, the tax and fiscal policy of the state is not working to move our state forward. And it's not investing in individual people the way we need to allow them to prosper and to succeed in our society. And it's creating wider income gaps. And so we've got to be changing our mindset at the State House and really work on asking ourselves, what is the revenue we need to really provide the services that our state needs? And I'll just close by giving you one example. Medicaid. The Medicaid budget has been growing. People who need health care, we have more and more people who depend on that program. Rather than the legislature asking itself, what do we do to find the resources to provide people with the health care they need? Instead, our answer is to just cut the program and try to keep people from knowing that they could even apply for that program.
Matt?
Thank you.
Thank you very much.
Thank you, Representative Matt Pierce. We have asked 8 city and county officials to be on our panel. They will each in turn give a 3-minute response, a timed 3-minute response to how they plan to adapt to these budget cuts. There will be a chance for you to submit a written question later in the program. We also have 5 community resource managers for food, housing, healthcare, safety, and education. Their statements will follow the panel. Mayor Kerry Thomson will start our panel statements. Mayor Thomson was elected in 2024 and is in her second year of a 4-year term as Bloomington's mayor. She is a former CEO of Habitat for Humanity of Monroe County and the former executive director for Indiana University's Center for Rural Engagement. Mayor Thomson, what budget cuts from the state do you anticipate, And how will you lead Bloomington to adapt?
Yeah, thank you for having us tonight. And I really want to thank Representative Pierce for his ability to boil down the complexities of tax law in Indiana so that the rest of us, normal non-legislators, can really digest it. I want to note that tonight we're talking about the tax cuts in the state and what that's doing to state funding. But it's important to know that, and I'm sure some of the providers are going to highlight this as well, the federal cuts that we either have already experienced or we are anticipating are also coming into play at the exact same time. And so from a city perspective, we're looking really broadly at a number of cuts that we are anticipating and planning for. And as Representative Pierce said, SEA 1 really changes the game for how cities like ours are funded. And while it's labeled as a tax cut, really those with the lowest wealth are going to see the lowest cut. And in fact, once we implement some local income tax to try to recover the local income tax that we had been used to getting, because those are fading out, I anticipate that people in our community are actually going to end up paying more taxes than what they're used to. The changes to the property tax and local income tax, which is what we call LIT, are phased in by 2031. And so what we're seeing right now is just $1.4 million of loss in the 2026 budget. But we anticipate we will be up to $30 million in loss in 2.5 years from now. This law obviously reduces municipal revenue in multiple ways. And they have a compounding effect over time. And so at the city, what we are looking at is, we're committed to providing the best possible services to our community. And we know that some of the things that we should have been doing all along had already been deferred. So maintenance on things like the snowplows that are driving out there tonight, and maintenance in our parks has already been behind, and now we're looking at a decreased budget and trying to keep up. So our philosophy in the city with how we're approaching this is to honor the commitments that we've already made. Obviously, we're meeting the basic needs of water and sewer and public safety. And then we need to take care of what we've got. And that's where the maintenance comes in, and really trying to stretch what we already have to make it last longer and to do more with what we have. And so when folks are coming to us saying, I have a great idea for a new park, it's probably not going to happen. We're still trying to figure out how we're going to maintain all of the infrastructure and all of the parks that we already have. And we are doing this in the face of cuts that you'll hear from our social service providers they also are experiencing. And so frequently the city would like to step in and start filling some of those gaps that social services are experiencing. And people, for instance, when they lose their SNAP benefits, we were able to do something last year and add to some of the funding that we provide in food services. But we will be less and less able to fill those gaps. So again, at the city, we're focused on delivering core services, on stretching what we already have, and making it really last longer. While I have the microphone, I just want to state the obvious, which is it's really important that you voice your concerns to the State House. And it also is really important that we focus on the elections that are coming up because it's not only midterms, but we're doing things like electing our county clerk in the coming year. The county clerk supervises the elections. And so we want to be sure that we have somebody who is responsible and is really committed to getting as many people to the ballot box as possible.
Thank you, Mayor Thomson. Our next panelist is City Council member Hopi Stosberg. With a background in executive level volunteering for education, the Interfaith Winter Homeless Shelter, and refugee needs in Bloomington, Stosberg from District 3 is just beginning year 3 of a 4-year term. Councilmember Stosberg, what budget cuts from the state do you anticipate, and how will you influence the City Council to adapt?
Hi, Steve. Thank you so much for having me here. I have no idea what that sound in the background is. There we go. Let me get back to my notes. So thank you for having me here, and I appreciate flexibility shown by everybody to transition this to a virtual event. And I just want to say that I represent District 3 for the City Council, and that is on the north and east side of Bloomington. And I think that Mayor Thomson, thank her for speaking tonight. I think she did a good job of throwing out some actual numbers that they're anticipating right now. So I'm just going to take a second and kind of delineate where the responsibility lies. The mayor and the administration's office, they set the budget, and the City Council approves the budget. And all we can do as City Council is cut things. We can't add things. We can't move things around. The only thing that we can legislatively do is approve, disapprove, or cut. And so just to kind of make that clear, it has to be a really cooperative sort of experience between the administration and the City Council. So in terms of like what cuts I anticipate in terms of specific programs, it's really hard to answer that right now because there are still changes that might happen. As it was said by, I think, both Representative Pierce and Mayor Thomson, this isn't so much a tax cut as it is a tax shift. And so if we're going to get less revenue from property taxes, but maybe then we can get some of that made up in local income tax. But there's a penalty to doing that in terms of asking people to pay more income taxes, because it's just shifting the tax burden and the tax responsibility around in ways that is also really uncomfortable. So it's hard to say exactly what it is that I would be interested in cutting. And so I think what I decided to do was talk about what my priorities are in terms of spending city dollars. And then also spend a couple minutes to talk about different processes that the City Council and the administration have collaborated on over the past couple of years while we've been in office. So in terms of spending, one of my essential priorities is maintaining quality systems and services and facilities that we currently have, and ensuring that we continue serving the Bloomington community in the ways that local government is responsible for and uniquely capable of. And I think the mayor and I largely agree on that point, and that's the importance of that. We need to make sure that the city continues to operate effectively to keep streets safe and clean, transportation corridors operational, trash picked up, water clean, emergency response, a whole number of things. And then in addition to servicing those city residents, I also think as a government, through our budget priorities, I prioritize serving our city employees as well to ensure quality working conditions and fair salaries. And so to me, those are the basics. Those are the things that we really have to fund no matter what. And then after that, it's expansion of those services to improve systems, to improve facilities, and then in supporting residents in times of need and crisis. So over the past couple of years, the administration and the City Council have collaborated through a shift to outcome-based budgeting or priority-based budgeting, which focuses not on what we've historically spent money on, but on the outcomes or achievements that have been made from those expenses. And so work is ongoing to create that priority list and categorize expenses along those priority lines. And this process is really going to help us make what may be really hard decisions moving forward as the revenue models change. And then last year, as council president, I did create the special fiscal committee, and I served on that last year. And this year, I'm chairing it. And that committee is working toward increased communication with administration and with community members around collaboration and understanding of budget process and revenue sources that fund our city government. And so especially in this unknown landscape of change in terms of what am I going to do, that kind of collaboration between City Council and the administration is really, really important. We all need to be on the same team to get through this. And additionally, it's also really essential to collaborate with other units of government, and especially in our case, county council is really essential. And so I've personally opened lines of communication with various county council members in light of revenue model changes and how we need to work together to ensure continuance of essential community services. So I'll highlight 911 dispatch as one of those situations where right now, in terms of how it's funded, that is going to have to shift, and that is a service that is kind of jointly provided between county government and city government. And so it's things like that that we have to look at and figure out how we're going to move into the future with.
Thank you, Councilmember Stosberg. Ellettsville is an important. Yes.
I need to interrupt for a second. It turns out as we move forward, the opening remarks are actually going to be limited to 3 minutes as opposed to 5 minutes from here on out. I guess we had a little bit of a time change, but then there's going to be the other 5 minutes. Is that right, Michelle? Is that what you're asking for, Michelle?
Yeah, for the this section of the electeds, they each get 3 minutes so that it adds more time for Q&A. Yeah.
Okay.
Yep.
Thank you. Thank you, Steve.
Okay. Thank you, Councilmember Stosberg. Ellettsville is an important town in Monroe County, so we are very happy to introduce our next panelist from the Ellettsville Town Council, William Ellis. As state coordinator for Braver Angels, Indiana, and former Republican County Chair, Ellis has brought those skills to a 5-member town council that basically manages Ellettsville as they have no mayor. Ellis from Ward 2 is in his 3rd year of a 4-year term. Councilmember Ellis, what budget cuts from the state do you anticipate, and how will you influence the town council to adapt?
Well, what we found this year is that, we did increase, obviously, our revenue collection. And that's one thing that I do want to clear up, that we've been fortunate where we've had double-digit growth. So we didn't have negative collections of revenue. Now, where it did hurt us, especially going forward, because it's nowhere near as much as the cost of services increasing and the demands of services that are increasing. We kind of knew, because for the last, I'd say 5 or 6 years, what I hear from residents in Ellettsville constantly is our taxes are too high. We're paying too much in property taxes. So everything we have looked at has been focused on that. Where other communities look at just raw assessed value for the whole community, when we set our tax rate and look at what we can levy, we say, how much of that is new growth as opposed to just stuff being worth more? So if we have, in the last 3 or 4 years, has been very high double-digit new growth, new construction on the tax rolls. So we've been able to do a levy appeal and actually come out fiscally, financially ahead. This year, though, which was interesting, we even had more growth. We were allowed one more levy appeal, but it was outright rejected, which would have caused us about a $400,000 shortfall, which would have been about 10 to 15% of our budget. Luckily, the appeal was successful on that, and we got some of that money. What we've had to do to adjust for that is a couple things. Number one, we were not able to give any raises. Our employees understood, and we promised them if the fiscal outlook changes December of next year, we'll put that as a Christmas bonus for those. And then we may be shifting more to a longevity system of rewarding people as opposed to just standard increases every year. We still want to give something. I was hoping we could give at least $500 to $1,000 this year, but it just wasn't in the cards. The other thing we've been hear from taxpayers regularly is that we don't want to pay for new growth. So that's why we developed this new growth in TIF districts, which won't really help them release their tax burdens now, but it will long term, because we're building the actual right mix of business and light industrial in those TIF districts. So by the time they hit the tax rolls, they'll be able to support an extra policeman, a fire station that we're looking at. And then third, a lot of people may have heard about it, we're looking at consolidation for Richland Township. Now, this will not change the fiscal outlook. I mean, we're still short. We're just putting two entities together. What it does do, though, is puts us in a better position in the future, because Richland Township has worked with Ellettsville for years with the fire department, culturally about the same. And we have people that are wanting to develop their property into the mix of property that can actually give true tax relief to our residents, but not starve local government. When we come to SB1, I've said it's the worst of both worlds. And I agree with the other panelists. I don't think very many residents are going to see tax savings from this. But what they have seen is unable to increase any services of parks and anything, but we've had to, I mean, they're not seeing any of these savings, but we're seeing the stress from it. I'm done.
Thank you. Thank you, Councilmember Ellis. Our next panelist is David Henry from the 7-member County Council. Formerly chair for the Monroe County Democratic Party, Henry is a career government management consultant and educator with expertise in homeland security and emergency management. He is an instructor at Indiana University's O'Neill School of Public and Environmental Affairs, SPIA. The council adopts the county's budget. Henry was elected in 2024 and is in his second year of a 4-year term. Councilmember Henry, what budget cuts from the state do you anticipate, and how will you influence the county council to adapt in 2026?
Yeah, well, thank you for having me, and thank you all for tuning in tonight. Let's get to it. So I want to take this in a different direction from what my previous panelists have talked about, because they've hinted at the obvious role of county council here. What's happened with SB1, aside from the fact that there's an average of a $300 per household property tax cut, which is really a soda a day at the gas stations worth of tax cut for property owners, is a shift from property owners to wage earners, and who's going to carry the burden of funding all of our governments, state and local. County councils have basically been put in the driver's seat to make a lot of those decisions. And any of us that ran for county council did not anticipate that we would be put in a position where we'd be making decisions on all tax rates in the county in the years ahead. So what does it do? One of the things it does is it eliminates a lot of the little small local income taxes that my colleagues have mentioned. I've heard like for the public safety, 911, for example, all those funds are going to consolidate into something much smaller. And each unit in this county, whether it's the city of Bloomington, town of Ellettsville, MCCSC, would have to come before council to talk about the rate changes every year. And so it forces those decisions locally and really puts county councils in a place to say, of the scraps we have left to work with in income tax, how does that get divvied up to the cap that exists in the community? It puts us in a horrible situation to try to, I think, in one argument, say prioritize things, but what it really is saying is choose among the essentials in your community every year, and it really forces us to have an unnecessary debate. And this is really an artificial austerity at the end of the day forced on our community. So now the county council has to be in the seat working with our partners on figuring out how to divvy up that pie. There's a few pieces that we need to think about. And again, just for folks listening, what county council does is similar to city council, except it is the fiscal control for the whole county. It is at this point. It also is the place where we can raise and lower the taxes in the county. So of course, that's when we see people come in to talk with us about those things. When it comes to future taxation and what it looks like, I don't have a crystal ball into what the cuts will happen. The message is to do more with less, but I think it's important to frame out a little bit about where this might go in the time I have left, and we can get to the discussion here. There are the consolidation of taxes in the county for the unincorporated parts of the county. So we're talking townships where you don't live in a town of Ellettsville, a city of Bloomington. There's an opportunity where, depending on how the tax rates break, that homeowners in those incorporated areas may actually see their tax change in a decreased sort of way. They may see an overall decrease in their taxes, which is unusual living in the unincorporated spaces if the county government goes forward and taxes to the full 1.7% that it could. For homeowners in incorporated areas, they may see tax increases based on what you've already heard on the call to maintain essential services and the programs that go on in those communities. So we are in a place where in the next few years, every tax year is going to look a little different as we try to maintain services. services. I'll say lastly that in the county government this year, we were fortunate to use some of our programming and tax revenue that we had to not only provide a 3% COLA to our workforce, but also continue on longevity pay for our employees to help with that retention and living wage in the community. Those days are probably not going to be duplicated in the years ahead, but my entire Democratic caucus that I work with has been committed to making sure that we are attracting the talent that really keeps us safe, plowing our roads right now, our deputies in the field, patrolling our community, our health workers, our assessors and our surveyors, and all the people that work hard to provide the essential services in our county. I look forward to the questions that are coming up. Thank you, Steve.
Thank you, Councilmember Henry. Sheriff Ruben Marte is our next panelist. Bilingual in English and Spanish, a graduate of the FBI National Academy, and a 31-year veteran with the Indiana State Police. Sheriff Marte is in his last year of a 4-year elected term. In-service training for correctional staff has increased 500% since he took office. Sheriff Marte, what budget cuts from the state do you anticipate, and how will you adapt?
Good evening, everyone, and thank you for the question. And thank to It Takes a Village Steering Committee for inviting me to be part of this discussion. As we look at Senate Bill 1 and the broader direction coming from State House, the biggest challenge for sheriffs across Indiana is uncertainty. And when state policies challenge how revenue is distributed or capped, the impact are felt first at the local level by counties already operating with limited flexibility. I want to be clear that Monroe County Sheriff's Office has always been conservative with taxpayers' dollars. Again, conservative with taxpayer dollars. Fiscal responsibility is not new for us. Our jail kitchen staff routinely searches for cost-effective food options when purchasing meals for residents in our care. Our deputies fuel vehicles through the County Highway Department bulk fuel system, which is far more cost-effective than retail pricing. We actively manage overtime to control costs while maintaining safe staff levels. Our patrol vehicles are regularly maintained to extend their services life and delay costly replacement. These are just a few examples of how we respect taxpayers' investment every day. As a result of Senate Bill 1, the areas most at risk are not extra. They are staff, training, equipment, and core public safety services. Cuts costs means delay vehicles replacement, postponing technical upgrades, and or limiting staff flexibility. Since taking office, we have increased in-service training for correctional staff by 500%. That was a deliberate choice. Training improves safety, reduces liability, and leads to better outcomes for staff and the people in our custody. Preserving the progress will remain a priority. So how do we adapt? First, we will prioritize core public safety function. Emergency response, jail security, and constitutional policing will always come first. Always come first. If cuts occur, discretionary spending will be reviewed before frontline service are compromised. Second, we continue to look for efficient and participation in making every dollar work harder. And third, we remain transparent with the public about the real impact of funding decision. Local law enforcement did not create this pressure, but we are responsible for managing them. My commitment to do so responsibly responsibly and transparently, and with public safety always at the forefront, always at the forefront. Thank you.
Thank you, Sheriff Marte. As part of a 3-member executive body that creates the budget and sets tax rates, County Commissioner Jody Madeira from District 3 brings her skills as a lawyer, professor, and public advocate to the table. Elected in 2024, Madeira is in her second year of a 4-year term. Commissioner Madeira, what budget cuts from the state do you anticipate, and how will you influence the County Commission to adapt?
Thank you so much for having me as a guest tonight and for hosting this important forum. So as you mentioned, there are 3 of us. We're the executive and legislative heads of the county. We oversee departments. We manage county property and infrastructure. We adopt ordinances, approve contracts and claims as party governance, and we also make appointments to key county commissions. So we as county commissioners have really had to pull back from projects we were really excited about that should have already been in place. One I can think of is rural internet connectivity. And we've had to pivot to just sometimes fighting for basic services. One thing I have not heard my colleagues say that I'd like to add on is that state budget cuts don't just arrive in isolation. They're delivered in legal cluster bombs that not only steal local dollars, but also ignore evidence-based solutions. Worse, they declare local programs unlawful, like needle exchange programs, and sometimes burden us with debt for causes that many in our community consider inhumane. So for one example, it's not just SEA 1 budget cuts. It's taking away money for certain recovery and health and housing services, coupled with criminalizing sleeping in public. And this law that's coming down that will allow private enforcement by the public and by businesses. And this law has already passed the House. It's passed the Senate committee and it's up for the vote in the Senate soon. And this will explode court dockets and jail populations, and it's inhumane. And it might seem like this issue is handled by the sheriff or by the judges and not by the commissioners, but commissioners also has to deal with this issue in an executive and a legislative sense. And as a county, we're not an island, and counties handle budget cuts unevenly. So going with this example, if County 1 with a large jail capacity thinks, well, we're going to start to arrest individuals who sleep on the streets, then folks without places to sleep might start leaving County 1, and they might head down the road to County 2 if County 2 thinks that's wrong or has a smaller jail, or both, and County 2 might start seeing some new faces. But thanks to SEA 1, County 2 can't realistically bond for large capital projects, those types of projects that all counties need, not just jails, but treatment facilities, hospitals, and infrastructure projects. And County 2 also doesn't have the social service projects that County 2 used to have before SEA 2 was enacted. And SEA 2 aside, again, the state's taken away laws. The state has taken away programs that, like needle exchange programs, et cetera, for other reasons, or federal funding has taken those programs away that County 2 could use to deal with these populations. So commissioners have to get creative in handling these despite defunded or underfunded programs, working with community partners on county council, the mayor, city council, and frontline workers.
Thank you, Commissioner Madeira. As an IT business analyst, Benton Township Trustee Michelle Bright is well suited to her role as Rural Township Trustee. Township trustees represent the most direct and accessible tier of local government and could easily be the first helping hand in a crisis. Bright was first elected in 2014 after being selected by caucus in 2012. But she has been elected ever since and is now in her 4th year of a 4-year term. Benton Township Trustee Bright, what budget cuts from the state do you anticipate, and how will you influence the Benton Township Board to adapt?
Thank you very much for having me here this evening and for the organizers to organize this. So Benton Township has had mixed results from SEA 1. Because of our small budget, we're not as impacted by these cuts as other units of government. So based on the fiscal analysis, we will only lose about 3% of our property tax revenue, roughly about $2,500 to $3,000 annually. Fortunately, we were able to adapt to this fairly quickly. Our one part-time employee resigned, and so I chose not to fill that position to offset this loss. As others has mentioned, SCA1 changed another significant source of revenue, the lit, and at this time, it's still uncertain if or how much revenue will be allocated to Monroe County townships. If the amounts are close to what we currently receive, we run lean enough, at least here in Benton Township, that we can continue to operate at a level of service as we do now. However, if townships are not allocated any lit or less lit, we might have to cut our budget up to 33% and start reducing non-essential services. This may mean mowing our cemeteries less frequently or not attending an annual educational conference. Fortunately for us, our Township Assistance Fund has plenty of money, and that's separated from other funds, so we can continue serving our neediest residents for as long as possible. While it's not necessarily a cut, another bill I thought I would mention that contributes to this conversation passed last year that impacts the financial stability of many townships is HEA 1461. This bill forced townships to spend down their cash reserves that exceed 100% of their budget or come up with a 3-year capital improvement plan to spend down these funds. Otherwise, 30% of these funds will be diverted to a new Township Roads and Infrastructure Fund on an annual basis. So not only are townships looking at a reduction in property tax revenue, a potential reduction or loss in local income tax revenue, but now also a cut in our cash reserves that some townships like ours has spent years building up and rely on to sustain operations over time. Probably the biggest budget cut that's on my radar right now are 2 bills that are currently being considered in the General Assembly, House Bill 1315 and Senate Bill 270, which would reduce or eliminate township government by January 1st, 2028. This would especially impact rural townships, including Benton Township, and most importantly, our residents who are in need. In the end, my priority is simple: to keep stretching our dollars as far as they'll go and continue to work with my board to educate ourselves on these topics and options so we can respond quickly in order to ensure that we continue to offer the best service for our residents. Thanks.
Thank you, Trustee Bright. With a Master of Public Administration, experience as Assistant Director of Finance for the City of Bloomington Utilities, and as Executive Director of United Way of Monroe County, Bloomington Township Trustee Efrat was elected in 2022. She is in her last year of a 4-year term. Bloomington Township Trustee Efrat, what budget cuts from the state do you anticipate, and how will you influence the Bloomington Township Board to adapt?
Thank you so much. And thank you to my colleague, Trustee Bright, who I think laid out some of that very nicely. I'll speak a little more to an urban township like ourselves. Bloomington Township is the second largest of our county's 11 townships, serving more than 44,000 households. We have both unincorporated areas, and we have the northern half of the city of Bloomington. And while I do oversee 3 historic cemeteries, I handle the occasional weed complaint from outside city boundaries, I would say that over 95% of our work looks a lot like social services. We provide emergency financial assistance that helps prevent evictions every day. We help residents catch up on utility bills and avoid shutoffs. And we run a busy food pantry that serves more than 200 households each month on average. We help with bus passes, certain medications, medical needs. We cover burial or cremation costs as well. And we're a referral hub, a resource point. We distribute things like Narcan, feminine hygiene products, pregnancy tests, and other basic household items that can be hard to access when money is tight. We recently launched a representative payee program for individuals receiving SSI or SSDI who need help managing their finances. With a dedicated staff member running that program, those most vulnerable in our community can be confident that their bills are getting paid, their budgets are being followed, and that they can remain housed and financially stable. So we expected this program to only grow because the need is real, especially as people are aging. in our community. But the passage of SCA 1 and HB 1460 that Michelle referenced last year gave us pause on all of that. We estimate an immediate revenue loss from SCA 1 of about 5% of our budget. That's about $15,000 a year. And that's nothing to sneeze at. $15,000 keeps a roof over several families' heads. $15,000 keeps heat on for dozens of elderly folks on a fixed income. And $15,000 can buy a good amount of nutritious food for folks in crisis. $15,000 less a year also means that we will not be expanding that representative payee program and will not be able to add any part-time support for that busy pantry. I think the bigger concern comes when that local income tax sunsets, since it currently makes up nearly a quarter of our operating budget. So if that is not replaced locally, and I'm sorry to our county council members who get that terrible job of having to make up for what the state takes away, that impact will be significant. I think there would have to be some very hard decisions made by our board and I about which programs to cull. I'm hopeful we won't get there. But between all of that and then the current deliberations at the State House about the future of townships, it makes for a lot of unknowns. I imagine that once this legislative session ends and townships know our fates in terms of consolidations or dissolutions, we will have to have a more dedicated conversation about this path forward. But that might be a topic for another evening. And for tonight, I just appreciate this opportunity to talk revenue cuts, how we're handling them, and thanks again for organizing this.
Thank you, Bloomington Township Trustee Rosser. And George, I don't know if you're hearing echo or not, but I am. In addition to our panel. Yeah,
I have, but I don't know where it's coming from, so.
Okay. In addition to our panel of city and county officials, we have also asked community resource managers for food, housing, healthcare, safety, and education to join us this evening. Monroe County is blessed with many nonprofits trying to improve life for those in need, which improves life for us all. Although they don't often directly depend on tax dollars, they are affected by grants drying up, a retracted economy, and declining donations. Mother Hubbard's Cupboard is one of the area organizations working with our food-challenged population. With an Indiana University PhD in geography, an MPA from the O'Neill School of Public and Environmental Affairs, and 10 years in Bloomington, CEO President of Mother Hubbard's Cupboard, Megan Betz, has worked to bring healthy food to those in need. President Megan Betz, how do you anticipate that the budget cuts will affect your work, and how will you respond?
Thank you. Yeah, so I'm Megan. I'm from Mother Hubbard's Cupboard. Often called the Hub, we are a community food resource center located in Bloomington. We operate one of the largest food pantries in the region and lead programming to ensure folks of all ages meet their goals in the kitchen and garden. While folks leave our free hands-on programming with more know-how, we care most that they leave knowing they're an asset to our community. They are our abundance and they are cared for. We operate as a low-barrier client choice space. Folks come in and use their family's cultural needs, dietary preferences, and restrictions, and time constraints to select the items that work best for them from our pantry. We trust that if they arrive at our door, they need our services, and we set as few restrictions as we can manage on how much of each food item they can take. Our state is doing the opposite. In summer 2025, Governor Braun opted out of a federally funded program that would have offered payments to families to support children's food security through the summer. This year, SNAP dollars do less for Hoosiers as additional restrictions on sugary food go into place. We do not support these restrictions. Improving health and nutrition happens through improved access to healthcare, more affordable groceries, and better wages. At the end of the day, the calories Hoosiers consume are morally neutral. Our political and economic policies are not. I would be misrepresenting our work if I didn't name that Black, brown, queer, and disabled folks disproportionately need services like ours. It has become more dangerous and challenging for them to maintain educational progress, access life-saving medications, and enroll in programs and services that hold them in protective community. The current push to austerity is violence. It will cause bodily harm in the form of increased hunger and malnutrition, the negative long-term health impacts of which are well documented. There are lots of measures in the new federal and state budgets that will make folks hungrier, poorer, and sicker. I'm going to focus on the ways it impacts the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. 284,000 Hoosier households receive SNAP, and the majority of participants are elderly, disabled, or children. Here's a list of some of the ways that SNAP is affected. This is by predominantly the federal budget. SNAP funding faces the largest cuts in its history, losing $186 billion over 10 years. Refugees and asylum seekers are no longer automatically given access to SNAP. SNAP has more rigid work requirements on participants ages 14 to 64 who must work a minimum of 20 hours a week or receive only 3 months of benefits within a 3-year time frame. Benefits will not be adjusted to keep pace with rising food costs, making the same benefit levels less impactful over time. SNAP-Ed nutrition education is defunded, and states will now cover the majority of the administrative costs of this program. The current administration is making it more challenging to do our work while keeping those most at risk of hunger safe. It has made it harder to seek grant funds and maintain best practices that lead to more dignity and respect for those we serve. It has made it scarier and more stressful for our patrons. So what does this mean for the Hub? It meant a 13% increase in pantry visits in 2025, which we expect again in 2026. It means instead of using our pantry to supplement their groceries, more folks are depending on us for the bulk of their food. We anticipate seeing more seniors living on fixed incomes, more refugee families, more children, and more folks sharing stories of their struggles to find employment. We expect to see folks more stressed as they come to our pantry when they most need a state assistance and are less likely to qualify for it in municipalities too poorly funded to pick up the slack. So how do we respond? By prioritizing building relationships through community-centered programming and empowering our program participants. We will resist the sense of urgency that throws us into a panic. We will take the time to connect, advocate in the ways our community asks of us, and resist the idea that rising to meet demand will fix our food system when what it will really do is mitigate the symptoms of a damaging system. In How We Show Up, Mia Songbird tells us we get the future we want by practicing it now. What I hope we deepen our practice of is eating together, learning each other's names, inviting neighbors over for dinner and letting it be awkward, resistance training our muscles of neighborliness, because that is how we build a network like we're seeing in Minneapolis. It makes it easier to link arms when the wolf is at the door. With that in mind, my question to the panel is, how are you tangibly practicing the safe, abundant future we all want to see for our community? I realize that's open-ended, and I'm happy to offer examples to get the ball rolling.
Thank you, President Megan Betz. In September 2025, Beacon broke ground on Bloomington's west side with what will be the new facility to replace the aging Shalom Center. The new building will replace an abandoned industrial complex with permanent and temporary housing, healthcare services, and employment resources for the estimated 300 homeless in Monroe County. 96% of Beacon's guests are challenged with extreme poverty. 60% of those are women and children, 11% veterans. This new center got off the ground thanks in part to nearly $5 million in donations raised by more than 300 donors. Reverend Forrest Gilmore, as Beacon's executive director, how do you anticipate the state's budget cuts to impact this project and your service to the homeless, as well as your response to it?
Yeah, thank you for having me. It's an honor to be here and to speak with you all today and share with you. As we begin, I just want to express my awareness of the weather and the cold outside that's before us, and the people who are exposed to that right now. The people who are living outside, living in cars, living in the woods, living in alleys and other places. And just bring that into the room and the space and the recognition that that's happening in this very moment. I've been doing this work, working with people experiencing extreme poverty now in Bloomington for a long time. It's I honestly just celebrated 16 years with Beacon just this past weekend. And just the other day, in a group meeting, within a few minutes, someone labeled me seasoned, and another person labeled me experienced. And I think they were just politely saying that I'm getting old. But it's been a bit and a while doing this, and there's some advantages of that. One of the advantages, I think, is that I remember some of the changes that we've made over time that have made our community better. I've seen what it was before and where it's come and how that's improved things. I do remember a time when in our community we had so few resources that finding a home for people struggling with extreme poverty was near to impossible. That was just something that was not something we really could do as a community, especially if those individuals were living with disabilities and had income that was below what was affordable in rent this in our community. And thanks in large part, and I'm gonna, there's a lot to talk about in housing, but I'm going to focus on housing first in particular. And thanks in large part to Housing First and the federal funding of such programs, we actually built hope where there wasn't any. We suddenly helped people move into homes who hadn't had a home for years, and in some cases, decades, which I think is an incredible miracle, remembering a time when we couldn't do that at all as a community. I do remember a time also when healthcare was so scarce that people could not access much beyond emergency care. I remember a man with an infected tooth who removed it with pliers because he couldn't see a dentist. I remember another man living with Crohn's disease who had a colostomy, and he lived without medical supplies. So he used Kroger bags instead of colostomy bags to address that colostomy. I remember a third person that was living with MRSA all through his legs, creating lesions that would never heal. All three of these folks found housing through Housing First programs and were able to access health care after they moved into homes, leading to healing in each of their struggles. In addition to the benefits that these programs provide to residents, we know Housing First reduces arrests and drives down emergency room use. Our own program saw arrests dropping by 90% and emergency room visits dropping by 65% within a year. And that research is backed up by studies of Housing First programs throughout the country. Despite such programs, Housing First long having bipartisan support at the federal level, we have not seen significant financial investment by state government in the operation of these programs. And we are now seeing efforts to cut such programs federally by as much as 70%, which would be extraordinarily dramatic. While the federal cuts are not yet clear due to challenges in the courts and our community, a 70% decline in Housing First funding would effectively double the street homeless population, something I don't think any of us would wish upon us. This past Christmas, I spent the evening at Crawford Apartments with many of the residents as we celebrated with a holiday dinner. And I looked around the room and took in each of the faces of those gathered around there. And I saw the joy and the beauty and the tenderness in that space. And I worried that this might be the last time we get to celebrate Christmas together in this place. My question, and particularly I wanted to focus or address this question to David Henry. So David, I appreciate it if you would take this question on. What funding sources through local government would you champion in order to see these programs not just maintain the status quo, but expand in our city and county? And I'm particularly curious about creative fundraising mechanisms like local referendums or referenda to address such concerns. Thank you.
Steve,
Thank you.
Yes. I wanted to interrupt for a second. So I wanted to mention to the guests, the participants, that we're going to answer questions after Tracy's finished, but they have to put the questions in the question area. There's no chat. You have to add questions. And so far we haven't seen any questions. So we just want to make sure people know that's what the panelists are going to do next, is answer questions. And so let us know who you're asking. my point is. Okay, thanks, Stephen. I'm sorry to interrupt.
And also, Reverend Gilmore and President Betz, if you would like to post your questions to get the ball rolling, just remember to put one of those 5 tags at the beginning for the 5 topics of our community resource managers: food, housing, healthcare, safety, and education at the top of the question, if you would. It is estimated that Medicaid cuts could lead to the closure of as many as 16 rural hospitals in Indiana. And Indiana hospitals have already begun reducing their services in anticipation of the federal cuts. Communities can expect layoffs and closures. Ball State economist Michael J. Hicks says that as a result of these cuts, hospitals will lose 15% or more of their annual operating budgets each year. Tracy Hutchings-Goetz is the policy director for Hoosier Action, where she leads organizing and advocacy efforts to protect and strengthen Medicaid and support addiction recovery initiatives across Indiana. In her work, she elevates community voices to influence policy and defend access to essential health care and recovery resources for Hoosiers. Tracy Hutchings-Goetz, in your advocacy and organizing work, how do you anticipate the state's budget cuts affecting healthcare and recovery resources in Monroe County? And is there anything we can do to mitigate its effects?
Yes, thank you so much, Steve, and thank you to the organizers and elected officials and other community leaders who've been able to join us this evening for this panel. I really appreciate the opportunity. So as Steve noted, I work for Hoosier Action, and actually the dire situation of our healthcare system is actually the reason why I have transitioned back from just policy and communications work to full-time healthcare organizing again. So what that means is I spend my day having conversations with folks just like y'all on this call about their experiences with our healthcare system, whether they're Medicaid members or uninsured or covered through employer-based healthcare. And Hoosier Action, my organization that I'm a part of, we've had more than 50,000 conversations since 2018 with folks about healthcare. And in the last year, I've personally had about 175. So here's the thing I can tell you. Things are getting worse, and we are poised to have them get a lot worse unless we start to organize more and work together more to change the system. So I am very afraid that folks are going to get sicker and poorer, and people are already very scared about how they can get and pay for the care that we all need to survive. And as Forrest and others have noted, these systems, whether it's healthcare or housing or food, they're really intimately connected. So I'm going to start by giving a little bit of a state of play and then offer some really concrete things that y'all can do during this legislative session, because we're during a legislative session. And then turn to some of the things that can be done at a county and local level to protect and improve our healthcare system right now. So we have been talking, really primarily about state cuts, but because Medicaid, which is a massive healthcare program that covers, more than 1.6 million Hoosiers, is jointly funded through the state and federal government, we kind of can't escape the impact of H.R. 1 or the federal budget bill, which passed in July. And what that's going to do, really starting next year, is rip healthcare away from 267,000 Hoosiers. And that estimate is on the low end, to be honest. And likely, depending on what happens at the General Assembly this year, we're going to see an even higher number of children, of seniors, of people with disabilities losing their health care. So the average rate of loss is about 14%, according to current estimates, and that could then, go up. In Monroe County, that's 3,000 people. But what we're also going to see is just a general instability in our healthcare system, where more folks are experiencing a lack of continuity of healthcare coverage.
This is often called churn within Medicaid. So people getting kicked off and having to re-enroll or getting stuck on wait lists. And when you experience that churn, right, you are delaying care. So you are not getting antibiotics at the start of the infection. Instead, it is getting worse and spreading. You are getting sicker, and then you end up at the emergency room. Your life is in danger, and it is just a much more expensive version of care because you've delayed that coverage. So that's the kind of thing that we're looking at the human level here. And right now, studies have demonstrated that more than half of all Hoosiers are already delaying or going without health or dental care due to cost. I don't think I know anybody in Indiana who hasn't done that, right? Who hasn't delayed filling a prescription or going to the doctor because of cost. And I know plenty of people who have rationed their health care for these reasons, meaning they're not taking their insulin, they are delaying really essential meds. And that can lead to catastrophic situations that end up costing more and risking lives. And nearly half of Hoosiers have medical debt, and 20% of us have medical debt in collections. So again, this is a symptom of a system that is maximized for profit and not for care. And at Hoosier Action, we really believe that that is the purpose of our elected officials, to ensure that we can all live healthy lives and hold this system accountable to what we need as insurance companies jack up healthcare premiums, which is what we're experiencing right now, and big pharma increases prices for drugs, and these new paperwork reporting requirements make our Medicaid system more inefficient and move more money to massive corporations like Equifax or Maximus, which may or may not be companies that you've heard of, but that's what's happening. It's not just that we are potentially seeing a reduction in the amount of money available to fund Medicaid and other healthcare programs. It's actually that mandates at the federal level mean that it's going to be spent not on you or me or your local doctor, but it's going to be spent padding the pocket of corporations that do credit checks or run administrative tech backends. So how is this going to look in our community?
Excuse me,
yeah.
Tracy, but I'm going to have to interrupt you.
Oh, yeah.
We need to go on to the next.
Oh,
speaker.
sorry. I thought I had 5 minutes.
No, we changed that at one point because of time, because we had more speakers come than we anticipated.
No problem.
Thank you.
So I'll just name quickly. There's a set of options at the legislature for folks to take advantage of, and then moving forward, this is going to put an increased pressure on our local county government and county systems. And so I wanted to address a question to County Commissioner Jody Madeira about how these healthcare funding pressures increase as they're increasing. What are some of the concrete steps that the county is taking to prevent local clinics or hospitals from reducing services and closing? And how is the county going to step up and ensure that folks have continuity of care as we might see a reduction in care providers and a reduction in insurance coverage for folks?
Thank you, Policy Director Tracy Hutchings-Goetz. While most of us have not seen immigrants or refugees swept up by masked ICE agents and put into unmarked vans in our neighborhoods, fear and alarm are very present among our refugees and immigrants in Monroe County, even though refugees have a pathway to citizenship that should not be affected. They are all too aware that ICE is detaining and deporting them without due process, which is unheard of and the equivalent of a death sentence for some. It's just flat out not legal. Exodus Refugee Immigration has an office in Bloomington, and the resettlement director is fellow Hoosier Erin Aquino. Her experience not only as an AmeriCorps volunteer on Chicago's South Side, but also Peace Corps volunteer in Senegal, has informed her work with internationals. Resettlement Director Erin Aquino, how have the anticipated budget cuts affected your work, and what can be done to mitigate their effects?
Hi, everyone. Thank you for having me tonight and ensuring that we can get some perspective on the lives of immigrants and refugees in the state of our country. So as many of you know, immigrants and refugees continue to be scapegoated by national and state politicians, blaming immigrants for taking up too many benefits or portraying them as violent criminals taking over our street, which is ironic given what we're seeing play out in Minnesota. We understand that most of this is nothing but a ploy and distraction for letting disgusting greed and wealth continue to go unchecked, and an attempt to create fear and sow division among our neighbors. Refugees, when they were welcome to come to the U.S., were guaranteed to have food, medical care, education, and safety as they work towards self-sufficiency here in Bloomington and Monroe County. Unfortunately, our government broke its promise to refugees and took food stamps away from families and children in November 2025 and plans to take Medicaid away in October of this year. This puts even more of a burden on this population to pay the bills and stay off the streets. Refugees are often one of the most financially self-sufficient groups and incredibly successful. But our most vulnerable refugee neighbors, people with children, major health issues, and elderly family members, are still working on their journey of self-sufficiency. Taking away their benefits does not take away the need for people to eat, seek healthcare, or safety. And in many cases, it ends up costing more to provide healthcare to families if they are uninsured, as we heard from Tracy. Because, of course, every parent is still going to take their child to the emergency room when they need to. The hallmark of this refugee program is that it provided benefits to families needing a literal second chance at life. And what we found is it actually benefits our country economically, as we amassed $125 billion on top of the program in a 15-year period of time. But the pressure that we continue to put on this population and others, the more they are forced to use other services needed by populations already struggling, such as places we heard from today, food pantries and shelters. And those organizations are also facing cuts to their budgets, further complicating our community's ability to care for our vulnerable residents. Funding cuts to public safety are also a huge concern. Our clients once felt safe to be in this country and now live in daily fear. I speak with families every day who are afraid that ICE will come, who are children who are afraid to go to school, and children who are afraid to answer doors for fear of being kidnapped. Exodus and our clients have relied on the local fire department, EMS, and police numerous times since our inception in 2022. And I've personally witnessed several of our public safety representatives provide supportive, timely, and trauma-informed care to refugees in times of crisis. In 2024, actually, our small Somali population of about 20 to 30 people were experiencing high rates of discriminatory attacks at prominent bus stops in Bloomington. Exodus called on the city, the police, and Bloomington Transit immediately to address this issue. And within a week, we had a group meeting with Somalis and a police officer. Transit and city clarified their role of security at bus locations and committed to looking out for this population. We have not heard a report since that time. Of course, that doesn't mean it's not happening, but knowing that the police in the city were on the side of this population was paramount. And to continue to strip away the funds and support for programming that keeps people safe is only going to lead to more stress, more fear, and more danger. What are we going to do to mitigate this and these issues? Well, as community members face the loss of food and healthcare, our community must consider what resources it can offer. Exodus has begun to collect food and gift cards for families and works to connect clients to local food pantries like the Hub. Our community will need to consider what free or low-cost health resources it can offer starting in the fall to refugees, because they're not the only ones losing healthcare, as we heard before. And we must continue to think about how this political rhetoric and what's happening on the streets across the country affects our neighbors, and we need to speak up in defense of all our community members. And one thing that's really critical to remember is that when it comes to refugees and immigrants of humanitarian concern, the U.S. made a promise to welcome them in this country and help them start a new life. Funding cuts and the revocation of benefits like food assistance and healthcare coverage fly in the face of this promise. And these cuts are proof that those who are currently in power have zero interest in saving the public good. We broke our promise to so many immigrants in this country, despite the fact that immigrants teach us to be better neighbors to one another, contribute invaluable amounts to our economy, our culture, and our communities. My question for the panel, I know times are tough, and I know that we're all in the same boat here. But what steps can you take when it comes to budgets to deal with issues like vital access to food, healthcare, and public safety? Can we consider designating special taxes for funds that continue to support our neighbors in need? Because as you know, that is a growing need that we're going to continue to see. Thank you all again for the opportunity to speak tonight.
Thank you, Resettlement Director Aaron Aquino. Now for the last of our community resource managers. Ever since the Indiana Supreme Court established that education tax dollars could follow the child by ruling that the state's voucher program was constitutional in 2013, Hoosier public schools have seen tax dollars siphoned off to private schools. As an Indiana Coalition for Public Education Monroe County board member, Kerry Mixa is a driving force to ensure that we have strong, democratic, and well-resourced public schools for all students. She is a community organizer who mobilizes parents, a researcher who shows the impact of outside money on school board elections, and an author who analyzes policies for publications such as the Capitol Chronicle. As an activist for ICPE, Kerry, what do you anticipate the state funding cuts to mean for our schools, and what can the public do to mitigate their effect?
Thank you, Steve. Thank you all for having me. And this panel is stellar. You guys are just amazing people. And the folks here attending this, thank you for being here. Goodness. So Indiana Coalition for Public Education, right? We have existed for 15 years. That's how long vouchers have been around. This year, vouchers are universal. Oh, sorry. Actually, yeah, this year, 2026, vouchers become universal. For the school year of 2026-27, we have universal vouchers. We are a pro-choice state in terms of education. Our organization exists to advocate for high-quality, equitable, well-funded public schools for all children that are subject to democratic oversight by their communities. We believe in local control of our schools. I want to keep this short because I know time is lacking. We have a lot of good questions happening in the Q&A, and I know that there was one question about the cuts to public education via shift to private school vouchers and stuff. We are a death by 1,000 cuts. So vouchers is one way that we are experiencing cuts to traditional public education funding, and our public schools are traditional public schools that must serve all children. By law, they accept all children. So we have cuts there. We have cuts via not keeping up with inflation. And then we also have cuts via SEA1 or SB1. It's called Senate Bill 1 or Senate Enrolled Act 1. That's another level of cuts. So that for our community schools, which is Richland Bean Blossom and Monroe County Community School Corporation, totals to almost over the next 3 years, I believe it's like $20 million, which is not insignificant because like all of these other organizations and like how our city, town, and county councils have mentioned, we are very wise with the use of our spending of our dollars. Public schools throughout the state are fiscally conservative, and so it's a bit concerning what will happen because, and I'm just going to get to my question right now, and I think this is more for Matt Pierce, but I would love for someone local to chime in and explain why maybe they can't fiscally help here. There may be ways, but the funding method of our schools is complicated. But here's the question. As the impact of SEA1 and general defunding of public education overall results in fewer teachers, overcrowded classrooms, and reduced services in schools, what steps are being taken now and planned for the future to support our public schools? And I'm not asking for more bake sales. And that's all I have. If you are interested in knowing more about our organization, we're at indianacoalitionforpubliced.org. We have many calls to action on bathroom bills, 10 commandments in the classroom. These are our culture war bills. And then also this subtle takeover of local control, too much heavy-handedness coming from our state. Thank you so much.
Thank you, ICPE board member Kerry Mixa. We promised to save some time for audience questions, and Kerry's question, I think, will be at least partially addressed to Representative Pierce in a little bit here. We promised to save some time for audience questions. We will be using the webinar's Q&A feature. Again, when you submit a question, if you will, please start it with a topic label like education, food, healthcare, housing, or safety. That is going to help us to signal to our participants that they may want to speak. These answers will go for about 3 minutes, and I think there will be a little indication that your time is about up. So please know in advance that we're trying to get as many questions in as possible. And if I start coughing to cut you off a little bit, I don't mean to be rude, but we would like to get as many questions in as possible. So our first question is on the topic of food, and it may be directed to Megan Betz, but perhaps also to other elected officials. One of our participants says, I wasn't able to hear the discussion on food in the county, but what response has there been to hunger in Monroe County because of cuts from the federal budget, as well as state governments?
I think SNAP is another good example of this. So when we were having real awareness of what the government shutdown was going to do to SNAP for the first time in its history, it was uncertain if folks were going to get their benefits for the month or if they were going to be delayed. There was real public attention on the immediate impact of that because we ideally are supposed to eat every day. And so it was a moment where we saw an increase in new donors. You know, there's energy, there's enthusiasm, much like we saw in early COVID, to like join in and mitigate issues. And so it was a weirdly abundant financially time for us, and that really helped us take care of folks. We saw some public investment into the food bank, and when you give to Hoosier Hills Food Bank, you're also contributing to us because we distribute about a third of the food that they are sending through our region. And so there was public support, but I think the thing I want to emphasize is like I set our budget, and I'm going to be really frank that I have very little faith in public funding of our work moving forward. We don't receive federal support, really. We applied for community development block grant funding for what will likely be the last time because the restrictions on it for reporting scare us for the folks who receive our services, because we have to comply with executive orders that we don't agree with and that make people, especially folks who are refugees, who are working with Aaron, who, you know, we want to maintain their anonymity. It just makes it impossible. And so we will not be engaging with federal funding for the foreseeable future. And I see that, you know, everybody here is working really hard with increasingly limited resources. And so we're calling on individuals. And I think what we really need to think about this as is not like these blips of panic and crisis and flash intervention, but like the long crisis, right? Like we've been talking about hunger in the United States since the 1960s. Really, in the way we talk about it now, it's the long crisis. And so that's why I'm talking about practice. What are the interventions we're folding into how we function every day that becomes ritualistic, that is ingrained in us, so that when we go to set policy, it is more equitable. But I mean, the support we got was great, and it's gone. And we're right back to the level of hunger that we knew was coming for 2025.
Thank you, Megan. The next question is directed more to the issue of housing. I often hear, one of our participants asks, I often hear people talking about affordable housing as it relates to new construction projects. And I'm wondering who decides what is affordable. Is it a standard equation? Is this a firmly set level? Also, if allowed, how do we get around legislation previously passed that blocked municipalities from regulating rents?
I'll speak to this at least a little bit in terms of who defines affordable housing. So there's something called an area median income, which is federally defined. And so affordable housing is defined based on what percentage of that area median income that you earn, and it also depends on your family size. And so in terms of city code and in terms of what you've maybe heard the last several years about like, oh, building affordable housing or putting in an affordable housing unit, our development ordinance within the city of Bloomington, our unified development ordinance, has an incentive for developers to build affordable units. And the way that that was defined, and I say was defined, I recently actually instigated changing that definition a little bit. But previously, it has been defined. There's two tiers, and tier one, if you built 15% of units that were at 120% of AMI or below, then that counted as affordable housing. You got that affordable housing incentive. A tier two incentive, you had to build 7.5% of units below 120% and 7.5% below 7.5% of units, I think below 80%. And that counted as affordable housing. And that might be a lot of like terminology. It ends up being complicated, but that's what counts as affordable. And one of the things that I have been looking into is that those percentages based on our area median income, which is pretty high, the rents that result from that are not actually affordable. And so that's why it feels like, oh, we're like bragging about making affordable housing, but that housing isn't actually like, it doesn't actually feel affordable because our median income is so high. And so recently I actually worked to change those affordability incentives in our development ordinance. So now those tier one affordability is dropped below 90% and tier two affordability below 70%. And so maybe that will make future developments more affordable. But it is this tricky thing where affordability, I mean, it really depends on how much money you make, whether something is affordable for you. And the minimum wage in Indiana is still $7.25 an hour. Like the living wage in Bloomington, I think right now is like $22 an hour in terms of that minimum that people say. So for some people, it probably feels like nothing can possibly be affordable. I hope that at least kind of addresses that answer.
Yep. Thank you very much. Thank you. We have another question here. It looks like it will be addressed to Representative Pierce. I hope you're still here, Matt. One of our participants asks, could Matt Pierce address the impacts of cuts to public education via the private school vouchers a little bit more? The unfair lack of requirements for privates and charters, the no income limit on getting vouchers, the lack of accountability in terms of testing, oversight, etc. Was most of this in SEA 1 also? It's kind of an omnibus question about the impact of cuts to public ed and sort of inequities in the systems that have been set up. Is Matt Pierce still here?
Yep, I'm here. So
great.
There's actually been a long-term kind of parallel things going on with school funding that are both detrimental. So first on the voucher side, that's been a very slow rolling bait and switch, which has been culminated with the wealthiest Hoosier families being able to be subsidized by the state for their kids' private education. In 2011, when the Republicans took over the legislature, they began this voucher march by essentially saying, we just want to take care of the poorest kids who are stuck in really bad schools and give them the same option as wealthier families and allow them to choose to go to a private school that better fits their needs. They couched it in terms of a civil rights imperative. Once they began to get that go, then every year for the last decade, they've expanded it and started out saying, oh, well, gee. And the other rule was they had to be in a school determined to be failing based on test scores and other metrics. And so then it was like, well, if the 1% person in the family qualifies, the siblings should qualify too. Then they began to expand out the income qualifications. And so we arrived at a point where we just have vouchers for everyone. And that's because I believe the ultimate goal is to privatize the education system, and just every parent will get a check and they'll say, go buy some education. I think that if they'd said 10 years ago, that's our ultimate goal, I don't think it would have been supported. So that explains why it's gone that route. And of course, many of those schools are religious schools that the General Assembly has no interest in regulating and ensuring that they're meeting the same requirements as public schools. So you have an inequity there. The other thing is the legislature essentially took over most of the funding of our public schools through sales and income tax. And income tax, they've been consistently cutting, as I mentioned before. And so what they're doing is they're kind of making the funding formula look like there's more money there than there is by moving things into it. So, for example, finally, it was a good move. The state said, we will pay for curricular materials. We used to just call them textbooks. But what they've done is they took that money and they put it into the funding formula to make it look like they were giving more money for each child. And they always say, we're giving more money to education in this budget than the last one. And that might be true, but they count everything. They count the private school vouchers. They count, the textbook
George,
things that were separate.
And you set the 3-minute timer period. Thank you. Thank you, Representative Pierce. So the next question is especially timely if you've been following the news today. And I think we probably have a few different panelists who might be interested in addressing this. What is the local plan for when, the participant says, not if, ICE comes to town? So I'll read that again. What is the local plan for when, not if, ICE comes to town? Is there anyone who feels comfortable addressing that?
Well, I'll try take a shot at that. That is such a difficult question to answer. As local law enforcement, we do our very best to provide public safety at our level. When the federal agency comes in, our options are so limited what we can do and cannot do. As you see in Minnesota, what they're going through right now, it's so difficult to wrap your brain around this thing. How do we respond at a local level, short of lawsuits? I am lost for words. I really am. Who would have thought we would find ourselves in this situation where we have to think about how do we deal with our federal partners? It's a very tough situation. I don't have an answer. I just don't. I wish I did, but I don't, because we are a very close-knit community. We will help each other as much as we can, and we will continue to do so. But the way this administration is acting and conducting themselves, it's never been done before. We have never had to deal with this before. I'm just lost for words.
Mayor Thomson, do I see your hand up on this one?
You do.
You're
and
muted.
Sorry,
Yeah.
I'm trying to get
There we
unmuted. I want to thank Sheriff Marte for taking the first shot at that. It is, I think one of the most important things to say here is that our local law enforcement works together really well. And they share a philosophy of keeping our focus on keeping the people of Monroe County safe. And so what we are charged to do is to enforce just criminal activity. That means we will not be enforcing any immigration laws. And I think that we have a great track record of community policing and really trying to keep people genuinely safe here. This is a time, as Sheriff Marte said, that is unprecedented. And it is also a time when ground level care for one another has never been more important. And so I don't want to put anybody on the spot in particular, but I do just want to give a lot of credit to Erin, who's on this call with Exodus, who has been an incredible organizer, and she has been incredible about getting information to people who need to have that information, and helping to create some systems of care in our community. It is important, and it's important that we act in neighborly ways that we have never been called upon to act in this way during our recent history. So there are good people working towards this, and my commitment is that our police force will only be enforcing criminal activity in Bloomington, the city of Bloomington.
Thank you. Jody, Madeira, did you have something you would like to say on this topic? If not, the next question will be directed to you.
Yes, I'll just add that actually ICE has been here on and off for years. That is not something new. So I think what we're talking about is when ICE shows up, like scary mass ICE. And but I did want to reiterate that people have been present for years from Border Patrol and taken people for immigration purposes, and they have had a presence in Bloomington. And basically federal immigration enforcement has been here before. When they are present, basically the city and the county are not notified in advance. We cannot stop ICE from operating locally. And so when required, we cannot hold someone in our jails just because ICE asks. There's been this issue in the news of, for example, when someone is ordered by a judge to be released, can we hold them for ICE? The answer is no. Once a judge orders someone to be released, no matter what they've done, what they've been alleged to have committed, we cannot hold them. If we hold them, that's a Fourth Amendment violation. That's really bad. So basically, we let ICE know that, or the sheriff tells ICE this person is going to be released, and ICE has a certain time that they can come get them. If they don't, then that person is released, and that's not our responsibility. And if we don't, if we were to hold that person, the county could actually be sued, and counties have been sued, Los Angeles, for example, for millions of dollars. And so that is not a responsibility we want to foist on our taxpayers. And so I think that that's just something that has been high profile litigation elsewhere in the country. And that's something we do not want. We don't want to violate civil rights here in Monroe County.
Thank you so much. That's really helpful. And I'm going to give you a chance to catch your breath here for a second. Somebody asked, would one of the facilitators let participants know how many have been participating in this meeting? I look down and I see 92 participants, but maybe George or Michelle can correct me before the closing in a few minutes. Jody, one more question for you. One of our participants asks, why is Monroe County proposing a $250 million prison? And what will this do to Monroe County's long-term debt? So about the proposed prison. Jody?
So thank you. Actually, Monroe County isn't proposing a $225 million prison. that has actually been taken off the table. So before I was elected, since I started serving in January of 2025, the commissioners at the time looked at a number of options over several years. They looked at Fullerton Pike, they looked at Vernal Pike, and they landed on North Park. And they began to commission a jail plus basically a series of courtrooms and offices that together they called a justice center. And that was basically hard construction costs, 175 million. Soft construction costs added in was going to be about $225 million. And basically that was taken off the table by the bill which occasioned this forum, SB or SEA 1. And so also in October of 2025, the county council very, very openly and very, very explicitly said, we do not want this public jail, this large jail. We do not want North Park. And so actually this past Thursday, I think the county commissioners and the county council had a very productive conversation where we agreed that we basically need to move forward together cooperatively and transparently in finding a new location for a jail, not a justice center at this time, but a jail, which is our most immediate concern because we are under a federal settlement agreement that expired January 15th. It has been extended until April, but we basically have a 90-day window where we have to come together and demonstrate forward movement, or we could be actually under litigation by the American Civil Liberties Union if they decide not to extend the settlement agreement past April. And so the commissioners and the council, hand in hand, are going to solve this problem for the community in an expeditious and financially, fiscally responsible fashion. And we're going to get a constitutional jail built, and it's not going to be $225 million.
Thank you. David Henry, did you want to add a little bit to that one before we get to, I think maybe we have maybe two more questions.
Yeah. I'm happy to, just because when the word fiscal pops up, that's county council. So I think it's, and the question was about long-term debt. So I think that's important to answer. I can't improve on the broad strokes of what Jody said, but let me talk about the debt piece. So as proposed prior to that vote in October with the denial of the North Park property, which would have been a joint co-located 227-ish million facility. At that time, you were looking at roughly $5,000 per taxpayer that would have been paying for that in our community over a 20-year period. And that would include children that are growing up in the county that would be paying as part of their income tax into their 30s, paying that off. And what that meant for the community on the light end would be about a third of all local income tax going to that facility. And depending on some of the municipal talk about trying to claw back some income tax, could have been 2/3 of every local income tax dollar that the county had to pay for that facility. So the long-term debt piece was encumbering a lot of local money exclusively for that project. So we really do have to get back to the drawing board of what meets the mail for constitutional care, because we do not have that in agreement with the ACLU right now, and understanding that there may be other ways that we can help work through our criminal justice system, right, to make sure that we're funding other alternatives in the community, to make sure that the jail is the hopefully last choice, right, that we've been able to move people into other care. So I would just say that at some point the bill does come due on this stuff. And as we've talked about this entire time, when we have a state government that is shifting that burden to wage earners instead of property owners, what that means in Monroe County, which is a place that has a graying population and a young population of workers, but a very thin middle of people, 21 through 55, they're earning the wages you would want to tax for revenue to pay for the quality of life that we have. It ties back to an earlier question you had about housing, because we need taxpayers here that are and have high paying and good jobs here. And so all of those things are interconnected about debt service and how we actually move forward here. So it's complicated, and it goes a little plaid like my shirt on a Zoom meeting, but understand that I think the county council is very tuned in on what the tax burden is going to be for the current and future problems in the county.
Thank you. Thank you, David. Thank you so much. The next question is probably best aimed at Sheriff Marte. It's a safety question. The question is this: what was the result of the Indiana Attorney General's lawsuit claiming that the Monroe County Sheriff's Department was violating the Anti-Sanctuary Cities statute.
That is tough for me to answer. We're in the middle of litigation right now, and I've been instructed not to discuss matters of that topic. But it is ongoing at the present time. I could say that.
Steve,
Okay.
can I put on my political hat for a minute? I used to be a party chairman. Maybe I could to call the audible. So I want to share, first of all, I mean, I think we all commend Sheriff Marte and being a sheriff that believes in the Fourth Amendment. And this, I think Jody had pointed to that. Yeah, every one of us in elected positions have taken a constitutional oath to defend the Constitution of this state and the Constitution of the United States. And I think Commissioner Madeira was pointing at that with her legal analysis of some of this. I want to say from that old party hat perspective that, there's a reason why we're being targeted, as Minnesota is being targeted, as Portland is being targeted, as Chicago is being targeted. It's because our way of life works. And in Monroe County, we have figured out how to do things with our social service community, with our government, and how to support our community, groups like Exodus that have done work in the community, people on this call. And so I think that because it is political, we're dealing with an attorney general. Back when I used to work in DC, we used to call AGs aspiring governors, not attorneys general. And, we have to deal with that. So, I know that there are activists on this call from wonderful organizations that are watching this. And this is really about a time to bear witness. When you see things going on in this community, tell people. We are a networked community. Some of those ICE raids we've heard about, came through phones that got people connected. But he is doing an admirable job, and he can't talk about it because he is being sued by our attorney general for doing the right thing. But I just feel like someone has to say it in a public forum finally, that that is who we are as a community, and we'll do our part. So thanks for letting me put the political hat on for a minute, Steve.
Yeah, thank you, David. The next question maybe overlaps with several of you. It's explicitly an education question, but it may touch on several people here. Current H Bill 1004, House Bill 1004, would remove required work hours from individual teacher contracts, giving school districts unilateral authority to add duties and extend workdays without additional compensation. 25% of teachers in Monroe County already work a second job. On behalf of the Monroe County Education Association, the local teachers union, can officials please work to reject this? Teachers would rather teach, care for kids, and work to improve our larger community than to have to work 50 plus hours a week. Partly a statement, partly a plea. Anybody would like to address this?
Well, let me just say that I think it's the fact that the legislature does not like teachers having strong voices in the workplace through their unions. They want to have people operating like cogs in the machine. They want you to be assembly line workers. They don't want you to be equal partners in the educational system. And so this is just another in a long line of the last decade of attempts to marginalize the voice of teachers in the classroom and in their school systems. And, I've been fighting this forever, trying to preserve the voice of the teachers in our classrooms. And it's just like every other issue up there. If we don't get kind of tuned into what's happening and get people, contacting their legislators and networking across the street and really pushing to, pushing back on that bill, then it's kind of easy for it to move through and maybe people not to take notice. So it's just, we have to constantly be on guard and work hard to alert people and get them involved in the process.
Thank you, Representative Pierce. Anybody else on that one?
I'll go ahead and say a little something. For those of you who know anything about me, you know that I'm really passionate about public education. I'm a former teacher, and I just want to go on record and say that I'm incredibly supportive of teachers unions. I'm incredibly supportive of unions in general, and the right of people to negotiate that and how important that is in just like the structure of work and the quality of life and all of those things. And I was really, really glad. There've been a few bills recently in the state house that have reduced teachers unions' rights. And I was really happy that I think it was last year, maybe even the year before, actually, that our local school board, and nobody here is representing our local school board, but they continued to negotiate several pieces of a union contract with our teachers, even though the state kind of took away those requirements. So I guess, I don't have any control about how the school board decides to negotiate with the unions or not negotiate with the unions, regardless of what state law says they can or cannot do. But I just hope that our local school board continues to negotiate with our teachers union for a whole variety of conditions, and doesn't just do the minimum that the state will end up requiring them to do one way or another. I think that it's just a real travesty how teachers have been treated by the Republican supermajority in the state house. It's just horrendous, and I'm just very supportive of our teachers unions, very supportive of our other unions. Also want to give a shout out to the mayor's administration right now, because she's come in and done a lot of union negotiation with our AFSCME union, with our fire union, with our police union. And I think that those negotiations are just really, really key.
Thank you so much, Hopi. We've got one last question, try to squeeze in here before some closing comments. This one maybe overlaps with several of you again, and it has to do with the trans community. With the constant attacks by our legislature on the trans community, what can our state and county governments do to protect them, especially as it pertains to public access, let's say? Anybody feel comfortable speaking to this question?
Can I just jump in really quickly as someone who applies for like public sector funds a couple times a year? One of the things that I appreciate most about city and county support we receive, we can usually count on Sophia Travis support and Jack Hopkins support, is the really low barrier reporting requirements. There's a lot of leeway, there's a lot of trust there. And I think the more that grantors, public or private, can lean into that and give us the space to protect the anonymity and autonomy of people we're serving, it makes us more comfortable and confident in partnering with those funders. And it is just an immediate protection to everybody we serve. It's become a major deciding factor. And I just really appreciate the flexibility of some of the funding pots that our local folks have for us.
Anybody else like to speak to that topic?
I would just say, because the funding piece from County Council, I appreciate that feedback with the Sophia Travis program. And for those who are listening, we have a modest grant program for community services the County Council provides with the county commissioners to release funds. By no means is it a moonshot. It is often a Band-Aid on things or for immediate needs. But I would say to this group of people, because I think the theme of tonight, it takes a village, and a lot of you are looking for ways to advocate at a state and local level, especially, is to talk with your local elected officials. We're not made of marble. We're part of the community as well. And really, bring your ideas, because I do think as we are reimagining the local tax code and reimagining local income tax, there are opportunities to improve our ability to give to organizations. We just have to get smarter about it and really get into the Excel sheets and figure that out. I will say to the question, though, because I don't want to deviate too far from the question about transgender support, that one of the things I was happy about this year with Sophia Travis is that the new LGBTQIA community center, the Front Door, which had recently started to collect money to open a center for our community, had secured funding from us from the Sophia Travis grant program to help with seed money to purchase a facility. And so I'm glad that they applied, and I would just say, keep at it and coming to your county and really working with us to identify those resources.
Thank you, David. Jody, one last quick comment here.
Yep. I think that the county can commit to continue giving individuals who identify in that community or any marginalized community protections that are currently denied them under state and federal law, and encouraging employers to do so through chambers of commerce. And I think that's one of the strongest protections that they can have, because they're currently denied those rights.
Thank you so much. As we get ready to adjourn, I'd like to thank our speakers, our panel of city and county officials, and our community resource managers for their participation, And a big thank you to the audience for attending, especially with the last minute shift due to weather. We hope this town hall will inspire a greater awareness of the challenges faced not only by the local governments, but also the organizations that work to make all of our lives better. The part we all have to play now is to cast an informed vote. It's more important than it has ever been because it has never been clearer how our elected representatives make all the difference in our daily lives. It's up to us to support candidates who will listen to local voices. Talk with your friends and neighbors to make sure they're registered and that they vote. Right now, it is the decisions of state and federal officials that frustrate our best efforts to solve the problems that beg for attention. We cannot afford to be checked out. We'd also like to thank our sponsors for their encouragement and financial support. Bloomington, Indiana 5051, the Democratic Women's Caucus, the Indiana Rural Summit, the Limestone chapter of the Indiana State Teachers Association Retired, the Monroe County Democrats Club, the Monroe County Education Association, Organizing Indiana, Reverse Citizens United, and Stonewall Democrats of South Central Indiana. I'd like to say real quickly, I had a correction. We had 102 total participants at the maximum attendance today. But in closing, I'd like to just add this. As a retired teacher, I would like to read a statement from Ball State economist Michael Hicks from a column of his. If a diabolical James Bond villain were to craft a set of policies that ensure long-term decline in a developed country, it would come in two parts. First, spend enormous sums of money on business incentives that offer a false narrative of economic vibrancy. Then, cut education spending. With that, good night, everybody, and stay warm and safe at home. Thank you.